Welcome to the Science Whisperer channel. Infection prevention is a critical aspect of healthcare and public health that aims to reduce the risk of infections in various settings, including hospitals, clinics, and communities. It involves a comprehensive approach to identify, assess, and implement measures to prevent the transmission of infectious diseases. The first step in infection prevention is to understand the epidemiology of infections, including the types of pathogens involved, their modes of transmission, and the susceptible populations. This knowledge helps in developing targeted strategies to minimize the risk of infection. Once the risks are identified, infection prevention measures can be implemented. These measures include hand hygiene, proper use of personal protective equipment, PPE, environmental cleaning and disinfection, safe injection practices, and adherence to standard precautions. Additionally, vaccination programs play a crucial role in preventing specific infectious diseases. Education and training are vital components of infection prevention. Healthcare workers and the general public need to be educated about the importance of infection prevention practices, such as hand hygiene and respiratory etiquette. Training programs should focus on proper techniques for using PPE, handling and disposing of infectious materials, and recognizing signs and symptoms of infections. Monitoring and surveillance are essential to assess the effectiveness of infection prevention measures. This involves tracking infection rates, identifying outbreaks or clusters, and analyzing data to identify trends and areas for improvement. Regular audits and feedback help ensure compliance with infection prevention protocols. Infection prevention also requires a multidisciplinary approach, involving collaboration between healthcare providers, infection preventionists, environmental services, and other stakeholders. This collaboration facilitates the implementation of comprehensive infection prevention programs and the sharing of best practices. In conclusion, infection prevention is a multifaceted approach that encompasses understanding the epidemiology of infections, implementing preventive measures, providing education and training, monitoring and surveillance, and fostering collaboration. By prioritizing infection prevention, we can significantly reduce the burden of infectious diseases and promote a healthier and safer environment for all.